Hello YouTube, welcome back to another MMT treatment video with myself and Ninja. I'm Josh. Today we are looking at TMJ. So we know Ninja hates abbreviations. So what's TMJ stand for? Well, it stands for the temporomandibular joint, which sounds like a bit of a mouthful, but let's just break it down. So it's basically the joint that connects your temple to your mandible or your jawbone. And so there's some muscles that we're going to be looking at today, and we're going to be treating on Ninja to see if we can help people with this sort of pain. So if we have a quick look at this face here, we can see the temporalis, the masseter, and then underneath that there's these muscles called pterygoids that all control that jaw, control that joint movement, and can be linked to pain. A lot of people get this pain if they're stressed at work, they clench their jaw, a lot of teeth grinding. It's also associated to a lot of headaches. It's innervated by that trigeminal nerve that can branch up towards the eyebrow as well. So if there's a little bit of a tightness or sensation in that area, it can have that sort of referral up to the top of the head as well. But that's the anatomy out of the way. Let's get into some treatment, shall we? So, got Ninja down on the table, on his back, and I'm just going to come in here, palpate around until I find a tight, bound up bit of tissue, and then we just sort of follow our MMT philosophies of pinning, sustained pressure, until that tension starts to melt down. So I'm sort of on that masseter at the moment. So that masseter's function is to elevate the jaw, so bringing that jaw from open to closed, and it also does a little bit of retraction, so bringing that protraction. It sticks the jaw out, so bottom jaw out from its normal position, and I'm just sort of pinning, holding right into that spot. Now, Ninja's probably not going to be talking too much because it's a rather sensitive area, but a lot of the time just pinning and holding, sometimes getting him to open and close his mouth whilst we're here as well, get a little bit of active release or a little bit of a crack and a pop there as well, can really help. And like I said, this area is commonly linked to headaches. Now, sometimes when we are treating this area, we can get referral that can replicate that headache sensation. That's not necessarily a bad thing. It just generally means that we're hitting that spot that probably needs a bit of work. Particularly if these things have been long-standing and chronic injuries as well. We don't want to rush this sort of stuff. We just sort of pin, hold, sink in. But also making sure your client's doing okay. So how are we feeling there, Ninja? Feel like we're hitting some...
It's good. Therapeutic.
Yeah. So now, the interesting fact about the masseter muscle, apparently it is one of the strongest muscles pound for pound in the body. So think of all the chewing and stuff that we do. That masseter muscle is doing a lot of that action. So when we're talking, some people talk a lot more than others. That masseter is getting a good workout. So it's got to be strong. Alrighty, I'm going to slowly sink out of there. You can see the little bit of a pit that I was sort of travelling through there. So this masseter attaches right up to this zygomatic arch, or the cheekbone. So sometimes people can get a bit of benefit. I'm going to just change my positioning. Bit of benefit of coming up. Ninja likes the saying, attachment is the source of all suffering. So we find that attachment sometimes pressing into there can also get some relief. But it's also following client's directions. If they're feeling anything, feel like I need to shift an angle or anything, you listen to what they have to say. Feel like you're getting something there, Ninja?
Yeah.
Yeah.
It's good. good, really good. You can tell.
Yeah, I feel like the body just has this sort of innate knowing that it's uncomfortable, it's unpleasant, but it's doing good. And like I said, a lot of the times this stuff's chronic and it's been there for ages, and this muscle in particular, and even the temporalis, it can have referral into the teeth. Mm-hmm. So I've had clients that have actually been referred to me from dentists because they've gone to a dentist with a toothache, and they gone to the dentist, and the dentist goes, "There's nothing wrong with your teeth." And sometimes all they need is a thumb pressing into the right muscles, and that can relieve it. Alright, we're going to slowly sink out of that one. So there's two spots basically on the masseter that I was sort of working. Now we're going to look at the temporalis. So I'm going to get Ninja just to sort of rotate his head a little bit. I'm still supporting it, but this muscle here attaches up here and attaches to the coronoid process of that mandible. So there's a protrusion in the jaw that it attaches to, and sometimes in here the fascia might be tight, or the muscle might be contracted. It might be a little nodule somewhere. Now I'm feeling something because Ninja's grimacing again.
That's good.
Yeah. Again, we don't rush it. We find these spots, we pin and hold and let them melt. And so again, this temporalis, it's again one of those muscles that helps close the mouth. So when you're chewing and closing the mouth, and this one, instead of protruding the jaw, so sticking the jaw out, it actually brings it back in. And that's a big, big muscle, and there's a lot of different sort of trigger points basically around this ridge that we can sort of trace and find new little nuggets, or the little bit there I felt just sort of roll under my thumb as well. So just sort of pin and hold that. Good, man, you're doing well. I know it's it's not the most pleasant sensation. Maybe I can get you to try and tell the people what you're feeling when I'm pressing here, mate. What is it that you're sensing?
Depending on what angle you're on, you can kind of feel like something going into your eye or behind your eye a little bit, and I suppose just awareness of what muscles control different movements and things like that. It's just a good solid feeling, like solid sensation. I think that's a really good way to describe really good body work. Kind of sense something is being affected and changed and for the good. Yeah, it feels like it's affecting inside my head. If that's
it's clearing out all the garbage.
Yeah.
Leaving space for new information and more blood flow, oxidizing those muscles. Yeah, good, man. I'm going to slowly sink out of there. Again, you can see the tracing, the pit where my thumb's been, so you can tell I've been fairly deep into the side of Ninja's head there, but sometimes you do have to apply that force. Now, the next muscle and the last muscle that we're going to be looking at today is the pterygoids. Now, Ninja did a video on this not that long ago, and he's surprised that the pterygoids started with the letter P.
Yeah.
Who would have thought that? The English language is a rather unique language. Now these lie deep, so they're sort of under on the inside of the jawbone. Now a lot of practitioners out there will actually have the client open the mouth, wear a glove and go inside and treat through there. I generally don't do that because I like to keep my fingers intact. And I know a lot of people like to, if you're in pain, they'll bite down. So I don't want to do that. So again, finding the spot, again, so I'll push through the masseter a little bit, but there's a little gap in between that jawbone and, the cheekbone and the jawbone, that you can find a little hole, and you can sort of sink into there, and you can pin and affect a little bit, probably not a lot, but you can affect that muscle a little bit. If you just pin and hold that, you might be getting some of those deeper fibers of that masseter, but you can also get some of those pterygoids. Those pterygoids are the only muscles in the muscles that help you chew that actually open the mouth as well. So all the other ones close the mouth, these ones open the mouth. They also help your jaw move side to side, so like this. Now, if you're tight and your jaw's clicking, sometimes getting treatment through this particular muscle can make a difference. If you're not getting much effectiveness attacking the muscle through here, you can also, because it attaches on the underside of the jawbone, we can get Ninja just to sort of lift his head back up a little bit, and we can sort of come in underneath. And yeah, again, it's a really sensitive area, so we don't want to rush it, but this can be really effective too, getting that underside right where it attaches. Now, like I said, this muscle is quite deep, so sometimes people say, oh, you can't really affect it through manual therapy. I like to think that you can, but I've also had some experience like dry needling these muscles as well, and I've seen some really good results with sticking needles in, and that can sort of get that deeper level without it being too much of that compressive force on the body. So sometimes that compressive force can be a little bit too much for the client to withstand. Don't worry, Ninja, I'm not going to stick any needles in you today. That might be a video for a later time, but yeah, sometimes this sort of effective pinning and holding can be all you need. But like I said, if it's too sensitive, we still want to do some good work. So, alrighty, mate. I'm going to slowly sink out of there. Alrighty, mate. You're a free man. I'm not gonna bash you up any more. But that's just a little bit of a snippet of how we can treat TMJ jaw pain. If it's locking, if it's sore, if you're getting those headaches, come in and see us. Share this far and wide with people that you know that have jaw pain. Like, comment, subscribe to our YouTube channel. Put some comments down if there are any videos that you do want to see us post in the future. Put that in the comments because we do read them. And if you need any of this work, come see us, because everyone here at MMT loves treating this sort of stuff. I know I do. So come on in. Typical Bridge Road sirens going off at the end of our video, but yeah, come in and see us. Until next time, bye for now.
Thank you.